Hi guys, welcome to the last segment of the development of the four of the GIT. We are done with the foregut, we are done with the midgut. Now we are getting into the hindgut. Right. So the development of the hindgut it involves mainly the partitioning of the cloaca. Remember, if you remember very well, we said the cloaca is a cloacal membrane. And it is from the cloacal membrane where we get the future anus. Is it? So, what are the demarcation of the hindgut? So, you need to understand that the hindgut extends from the distal one third of the transverse colon, right, to um to the to the cloacal membrane, to the cloacal membrane. Right. So let's take a look. All right. So this is just a schematic diagram that is showing the lower portion and giving us an understanding of how the hindgut as well as a portion of the midgut is oriented in the fetus. So this portion right here becomes your hindgut. Your hindgut is from the distal third of your transverse process up to your cloacal membrane. So what structures of the GIT comes from the hindgut? One, we have a portion of the transverse colon, a descending colon, sigmoid colon, rectum, and the upper half of the anal canal. Those are the structures we get from the hindgut. So, embryologically, you discover we have this portion that is called an allantois. So, the allantois um, is going to be connected to the umbilicus, and initially it takes part in some things that involves the urogenital system formation as well as functioning. And then this portion, that's your Hindgut. So initially, the Hindgut and what's called the urogenital sinus, which will become the urinary system and the reproductive system of the genital system, they're initially in communication. And this combination is called the cloaca right here. So just like what happens in chickens, initially you cannot see, you do not see a separate compartmentalized system of the urinary system, reproductive system, right, and the excretory or the excretory system but separate, but you just see everything entering the same cloaca. So that's why you see that the chicken they just defecate with the urine, with all the things in just because there is one compartment. But it's not the same in humans. So we are going to have what you call a urorectal septum. It's just a mesodermal septum that is going to start to grow towards the cloacal membrane. So as it grows, it's going to separate the cloaca into ventral and dorsal. Right, let's take a look here. So you can actually see that we are the urorectal septum is growing, right? And if you are to take a section from this position, we can see that the urogenital, sinus, and the rectum, or the anal column, anal column, and anal canal, they are in communication. You can actually see the communication right here. But as the urorectal septum continues to develop, you can actually now see this is your cloaca membrane, and we are growing towards the cloaca membrane. We want to separate this portion and this portion, right? You want to separate this portion and this portion. So this portion has to be the rectum and the upper half of the anal canal. This has to be what we call the urogenital sinus. That is going to form your bladder, your urethra, your external genitalia, and so forth. Let's see again as we see the urorectal septum growing. Good. Now it is completely grown and it is fused with what? Cloaca membrane. Take note of this. When the urorectal septum fuses with the cloaca membrane, in adult it forms what is called the perineal body. So the perineal body, it separates the anus. In female, it separates the anus and the opening of the vagina. They are separated by the perineal body. It's also clinically important because we have important muscular attachment or insertion to this perineal body. You understand now? Good. So the portion that is now ventral now becomes your urogenital sinus. That will form the cranial part or the cephalic part will form the bladder, the middle part, if it is a male, will form the membranous urethra, the lower part will take part in the formation of the perineal urethra. You understand? Good. And then this become your rectum and your anal canal. Take note, the anal membrane, which is a portion of the cloaca membrane, initially it will be closed. All right? It will be what? Closed. And this portion is going to be called the proctodium of the anal membrane. So there's going to be canalization around the 7th week where we open the anal membrane to form what you call the anus, right? And you need to understand that the anus, this anus, it has dual origin, the anal column, the anal canal, right? So it is dual origin. It originates from the upper 2/3 of the anal canal comes from the endoderm itself. Then the lower 1/3 of the anal canal comes from the ectoderm. Right. So, which means that we now have different epithelia. So the portion or the plane where there is a junction between the endodermal origin of the anal canal and the ectodermal origin of the anal canal is going to be given a name called pectinate line. And on this pectinate line, you're going to see a transition of epithelia from simple columnar epithelia to stratified squamous epithelia. So this pectinate line can also be called the white line. Good. So there's also difference in blood supply of the upper 2/3 of the anal column canal and the lower 1/3 of the anal canal. Right, so the upper 2/3 is supplied since it's a part of the Hindgut. and the hindgut is supplied by the inferior mesenteric artery. So the inferior mesenteric artery is going to give or continue at the pelvic brim as the superior rectal artery. And it is the superior rectal artery that will supply the upper two-thirds of the anal canal. What about the lower third? The lower third is going to be supplied by the inferior rectal artery. Take note of this. And the inferior rectal artery comes from the internal pudendal artery. So there's going to be an anastomosis of these arteries, forming what called the portal vena cava anastomosis. So there's also portal vena cava anastomosis around the anal canal. Right. So you can actually now see this is in male, this is in female. This is external genitalia, and this portion that separates the external genitalia and the anus, right, is going to be called your perineal body. This is going to be your vagina. This is going to be your urethra, and then this space right here is going to be called your perineal body, and this is going to be your anal canal. Is it? Right, so let's just take a look at some developmental defect that can what can get wrong or what can go wrong during the Hindgut development. Right, so you may have a lot of fistula. You can have what's called vesico urethral fistula. This will be a communication between the urethra and the bladder, right? A communication, right? You can have vesico-vaginal fistula. Instead of the bladder being separated from the urethra, you see that the bladder now is separate, is completely fused with the vagina. So instead of the urine passing through the urethra, the urine passes through the vagina. We have a rectal vesical fistula. That's the fusion of the rectum and the bladder, right? So you can have fecal matter coming through the urethra or urine coming through the anus, right? Good. And then the last one, we have the rectal vaginal fistula. That's the communication between the vagina and the rectum. And you can as well have fetal matter collected in the vagina instead of passing through the anus. So thank you so much. This is everything that I have for you in the development of the Hindgut. Take care.